I'm Sarah Bechtel, and I am a MSW ASAP student, and I had my field placement at Stein Hospice. I've always been somewhat interested in hospice. Back in my hometown, there's a popular hospice called Stein Hospice. So I've always seen billboards driving by, and it's a popular, known agency. So I've always been kind of interested in hospice. Didn't really know a lot of what they did, just heard about it. So when I was thinking about what agencies to put for my placement, I just listed any hospice as an option and ended up getting placed with Acclaim for this year. Well, in hospice, we go through an interdisciplinary team approach. So we have a hospice physician and RN nurses, the social workers, chaplains, and then our hospice aides are kind of our backbone foundation. So we provide symptom management. The nurses are in charge of all the pain medication and connecting patients with any type of comfort measures like hospital beds or wheelchairs. And then the social workers provide a lot of the emotional support to patients and families, and chaplains do a lot of spiritual support, or just they like to refer to themselves as old friends that they've known for years to come in and be a friendly face. And then our aides provide a lot of the daily living tasks, such as bathing or light housekeeping around the patient's living area. There are different criteria that patients have to meet. They have to have a physician sign off in order to come and be evaluated for hospice services. And then the nurses will go through all the different criteria. So if you have cancer, you would have different criteria that you would meet. But ultimately, patients, if their disease progression continues, their life expectancy would be 6 months or less to qualify for hospice services. Yeah, we provide a lot of mainly emotional support to not only patients, but patients' families and loved ones that are in their home with them. So it's a lot of talking about how they're coping with their terminal diagnosis, talking about what end-of-life goals they have or what they want to achieve. A lot of times families will say, we just want our loved one to be comfortable, and so we want to inquire what comfortable looks like to the patients and their family. Some will just say, as long as they're still able to eat their favorite food, then we'll know they're comfortable. So really finding out what each individual patient and their family desires for the end of life and being of assistance through that, and providing education to family members about what they may see in the normal dying process, changes in breathing or sleeping, just some of those normalized things that to a family member can be really scary if you're not aware of. And we can help set up patients with other services such as emergency response systems, or help them with funeral arrangements, anything that they would need at the end of life, and making sure that they're kept comfortable and able to enjoy their quality of life. I would say the most fulfilling part is just being invited into patients' families' homes, or wherever they live, whether it's in the nursing home or the assisted living facility. Just being invited to share in the journey of their last days is a very rewarding experience, and it kind of makes you reflect on life and makes you think about what's important, and just sharing in those final days together is a very rewarding experience. I would say having a comfortability, being able to talk about death and dying, which doesn't come easily, and I would say I still have a long ways to go with feeling really comfortable just bringing up death and dying. So it definitely takes time and practice and experience. But also I'd say time management skills, because you're out visiting patients in their homes, so you're really managing your own schedule and who you need to go visit. But along with that, having the flexibility of knowing that crises come up, or families may experience something and you need to go spend hours with them. So kind of that balance of being flexible and knowing how to manage your time fill your responsibilities. And I think also just enjoying being with the elderly, because a lot of our patients were elderly individuals, and so just being kind of patient and enjoying that reminiscence, hearing their life experiences and stories.